Hello, everyone. My name is Benita McLarin. I'm the Director for Health and Human Services for the County of Marin. I'm really happy to be here with you today to talk a little bit about the COVID-19 coronavirus event. I know that a lot of people in our community and around the country are really afraid of this virus, and there are some legitimate concerns. And I would like to answer some of the questions that I have been presented for you today. One of the things, though, before we get into the questions that I really want to ask you to do is to please abide or adhere to our health officers' shelter in place or shelter at home order. This order has been extended to May the 3rd, 2020, and it's really important that each and every one of us who is non-essential worker abide or adhere to the shelter at home order. It really will make a huge difference in reducing the spread of the COVID-19. So please stay at home. The second thing I'm going to ask you to do is to please pay a lot of attention to your hygiene. It's really important that you're continuing to wash your hands as much as possible, to wash surfaces at your home, and to just make sure you're generally doing things to reduce the spread of germs wherever you are. So now I'm going to jump into some of the questions that I've been asked, and I'll try to answer them based on the information that I have. So number one, what are the symptoms of the coronavirus? So the human coronaviruses cause mild respiratory illness, and their symptoms are similar to the flu. Some symptoms include fever, cough, and shortness of breath. COVID-19 generally causes severe respiratory illnesses. So question number two, what do you do if you have all of these symptoms? So just remember that it is cold and flu season right now. So a lot of people have flu-like symptoms that are not related to the novel coronavirus. If you've traveled to a geographic area where there's widespread or sustained community transmission of COVID-19 within the past 14 days, and you have a fever, cough, or shortness of breath, we ask that you please contact your healthcare provider immediately and tell them about your travel and your symptoms. Please make sure you call ahead before you visit your medical office or the clinic or the hospital so that the provider can prepare for your visit. Please do not go to work, school, or any social events if you have any of these symptoms. The most appropriate response is to isolate yourself if you think that you have any of these symptoms and to contact your provider. Number three, what do you do if you've been identified as having the virus? What does it mean to self-isolate at home? And if you have the virus, can you live at home with your family? So the answer is, if you have the virus, you're going to be asked to, most people with that virus actually have mild symptoms and are able to recover at home without medical attention. Please do not leave your home and except to get medical care. And please, if you have the virus, do not visit any public areas. We're going to ask you to please stay in touch with your doctor and make sure again that you call your doctor before you seek care. If you're having trouble breathing, however, or you have any of the emergency warning signs, or if you think it's an emergency, please do respond using the emergency response system. We are going to ask, though, if you have COVID-19, please do not use public transportation. And that includes buses, ride shares, or taxis, or trains. If you have coronavirus, we're going to ask you to separate yourself from other people in your home, and this is called home isolation. In your home, you're going to stay away from other people in the home. If you can, designate a sick room if possible, and to use a separate bathroom if that's available. You're going to ask you to avoid sharing household items with other people in your home. That includes sharing dishes or drinking glasses or cups or eating utensils or even bedding with other people in your home. If once you use any kind of items in your home, we're going to ask you to thoroughly wash them with soap and water and put them in your dishwasher, if possible, for disinfecting. If you have COVID-19, we're going to ask you to clean all high-touch areas every day. In those high-touch areas, especially in your sick room and your bathroom, we're going to ask you to clean those and not have someone else clean those. If you have a caregiver or someone else in your home that can clean the other high-touch areas in your home, please do that. But if you're able, please only yourself clean those areas in your sick room and bathroom. If you have a caregiver or another person who needs to do that cleaning for you, please have them only do it on an as-needed basis, and have them make sure that they wear a mask and that they have gloves as long as they're have contact with the sick person. High-touch areas or high-touch surfaces such as phones, remote controls, tabletops, counters, doorknobs, door ledges, bathroom fixtures, toilets, keyboards, tablets, and other tables, bedside tables should be cleaned regularly. These are high-touch areas. We're going to ask you to clean any kind of body fluids using gloves if possible. Clean and disinfect. You can clean using soap and water and detergent or any kind of other detergent, and then use a disinfectant if that's available after you've done that cleaning. Be sure that you follow the instructions on your label and to clean effectively, and many cleaning products actually recommend that you let the surface wet for several minutes to ensure that the germs are killed. And many recommend precautions such as wearing gloves and making sure you have good ventilation when you're using disinfectant products. Most EPA registered household disinfectants should be effective to kill these germs. If you have COVID-19, we're going to ask you to monitor your symptoms regularly. Common symptoms that I mentioned before, including the fever and the cough. Trouble breathing is a more serious symptom, which makes sure you should contact your medical provider. If you're having trouble, again, make sure you seek medical attention, but call first. And if you're having any of the symptoms, we ask that you wear a mask if you have one available. If you can't put on a face mask, make sure that you cover any kind of coughs or sneezes at any time. Anyone with COVID-19, and actually any of us, should try to maintain 6 feet away from other people during this time. It will help us reduce the spread. And we ask that you please follow the instructions of your healthcare provider. Number 4 question, can family members still go out? I just want to remind everybody that on March 16th, 2020, our public health officer issued an order limiting activity, travel, and business functions to only those essentials. That means that none of us, let me reiterate, none of us should be leaving home except for essential business. No one should be going out and socializing in the community. Family members who are living with someone who has tested positive should also try to limit their activity outside of their home as possible. And if a family member must leave the home to perform essential activities such as going to the grocery store, they should do their best to reduce the possibility of spreading COVID-19 by social distancing at all times, remaining 6 feet away from folks, washing their hands with soap and water whenever possible, using hand sanitizer, avoiding touching surfaces and spaces, wearing gloves if possible, avoiding touching their own eyes, nose, mouth, and any with unwashed hands, and covering all their coughs and sneezes with a tissue. And I would just add that if you're going out and you're living with someone who is COVID-19 positive, please wear a mask. Number 5, if you have the virus, and do you have to be hospitalized? And the answer is not unless you have some of the emergency warning signs that I mentioned before. If you do have those emergency warning signs, you might have to be hospitalized and you need to get medical attention immediately. Let me reiterate Those emergency warning signs are trouble breathing, persistent pain in the chest, mute confusion or inability to arouse, and bruised lips and face. So this list is not all inclusive. Again, please contact your medical provider if you have any other symptoms that are concerning. Number 6, how will I access food if one of my family members tests positive? There are a variety of food sources available. People can find a comprehensive and up-to-date food resource list by visiting this website. Is https://foodlocator.sfmfoodbank.org/. Information on food resources and other resources, other services and assistance for older adults 60 and over and persons with disabilities. They can contact us by calling 415-457-INFO, or they can email us at 457-info@marincounty.org. If seniors or individuals with disabilities feel uncomfortable visiting any kind of local grocery store, some stores are having special hours to shop, including Safeway, which has Tuesdays and Thursdays open 7 a.m. to 9 a.m. exclusively for seniors, and Target is open Wednesdays starting at 8 a.m. exclusively for seniors. Costco, Nugget Markets, and Whole Foods also have hours exclusively for seniors. For some of us, loss of income is the largest barrier to meeting our food needs. And if this applies to you, please consider reaching out to the county's various assistance programs. We have Cal Fresh, Cal Works, and we have Cal Fresh, Cal Works, Medi-Cal, General Relief, and Women, Infants, and Children's, or WIC program. And WIC is a supplemental food and nutrition program for low-income pregnant, breastfeeding, and postpartum women and children under age 5 who are at nutritional risk. To apply for Medi-Cal, Cal Fresh, or Cal Works, you can call our 800 number at 1-877-410-8817. That's 1-877-410-8817. You can apply online at c4yoursulf.com, C for yourself, or you can pick up a paper application at 120 North Redwood Road in San Rafael, at 3240 Kerner Boulevard in San Rafael, or at the County of Marin Health and Wellness offices. Spanish and English copies are available. For WIC applications, please call 415-473-6889. And for General Relief, please pick a copy up paper application at one of the addresses that I mentioned before. You can also call 415-473-3350 for General Relief applications. For those who are unable to access any of those resources I've mentioned above and have no other means to get food or other resources, please call us at 415-473-7191. We're open at this call center Monday through Friday from 9:30 a.m. till noon and 1 p.m. to 5 p.m. You can speak to a live person and they can help direct you to many of the various resources that we have. We do have a limited supply of grocery bag deliveries that are going to be starting on Thursday morning, April the 5th. And these supplies are for those who have no other options to access food or only available while the supplies last. Question number 7, can I be tested in Marin City Health and Wellness Center? And we're working to establish a testing date and time at Marin City Health and Wellness Center. Until that date gets established, you can get a referral to our testing site in San Rafael through your physician or your doctor's office. Number 8, will someone from the county check in on someone who has tested positive? And the answer is yes. Our public health nurses are making regular phone calls to check in on everyone who has been designated or been diagnosed as having COVID-19. I just want to end by saying that, this is a really, again, tough time for everyone in our country. Nationally, no one is going to be unaffected in some way, whether you get the virus directly or not. Everybody is affected by this COVID-19. It's an unfortunate situation, but we can get through it. We need to support each other. We need to follow the directives of our health officer, and we need to work together to make sure that we reduce the spread of the virus and that we protect the people who are most vulnerable to getting the virus. So we're really trying to make sure that our healthcare system has enough capacity to meet all the demands, and we ask that you all will continue to work with us and seek us out for any assistance that you continue to have. Again, we're here for you, and if anything that you need, please feel to reach out at any time. Best wishes to you, and take care of yourselves, and best wishes.